Hello, everyone, and welcome to the Grand Challenges Canada webinar on monitoring and evaluation. My name is Emily Boost.
And I'm Rebecca Calder.
And we are directors at Core Global, a consulting firm that supports GCC's innovators with M&E. And we're really pleased today to be presenting this webinar on measuring impact. What we're going to be covering in this session are a few things. Firstly, what GCC means by measuring impact, why this is important, and how to do it. Just to note that the slides and recording will be shared after the webinar, and a short feedback survey will also be circulated to get your input. Great, so we've got three key objectives for the webinar today. First is to understand how Grand Challenges Canada approaches impact measurement. The second is to understand GCC's M&E reporting requirements. And thirdly is to learn about the M&E support available from Core Global. So what does GCC mean by measure impact? Impact can be defined in many ways, as we know, but for the purpose of GCC funding, it is defined as the number of lives saved and/or lives improved by your innovation. So what do we mean by lives saved and lives improved? You can see there's two definitions here up on the screen. There are standardized definitions of lives improved that have been established for all GCC portfolios. These definitions have accompanying guidelines on rigorous health outcome thresholds that should be applied. Generally, the lives saved or lives improved indicators are determined during the due diligence process ahead of going to the investment committee. For earlier stage innovations, such as TTS 1 or 2, this is usually determined by the deal lead and the innovator, with some input from the knowledge management team associate or the impact measurement manager, if necessary. And for later stage innovations, such as TTS 3 or 4, the lives saved or improved are usually determined via impact modeling during due diligence. In some cases, the definition for lives saved or lives improved happens later in the process, for example, during negotiations when targets or your expected results are determined, and sometimes this is an early milestone for the project period. So lives improved outcomes are different across different innovators. So for example, if we look at communicable diseases, lives improved outcomes could include things such as consistent behavior change for improved health, access and receipt of treatment service or services, or a decrease in the number of cases of the disease that can be attributed to the specific innovation. For mobile health, it might be things such as a solid outcome would be an increase in health-seeking behavior, such as ANC visits, breastfeeding, or post-discharge return to care. And finally, if we look at SRHR innovations, lives improved outcome could be something around increase in knowledge and/or health-seeking behavior as a result of the innovation, such as the use of SRH services, specifically thinking about sexual reproductive health services, family planning, or services to assist survivors of gender-based violence. Otherwise, this could also be a reduction in the number of cases or improvements to the quality of SRH services. So why measure impact? There are four main reasons why it's important to demonstrate your impact that we'll cover today. You may think of others. First, to attract investment, so making you as an innovation more sustainable. Secondly, to ensure accountability to funders and stakeholders and ultimately your end users. Thirdly, to generate evidence which supports your innovation and make improvements. And finally, to communicate your work to a wider audience, both the success and the brilliant failures, as learning is a public good. I'm going to hand over to Rebecca now, who's going to talk us through a logic model.
Fantastic. Thanks, Emily. To measure impact, you need to have a detailed understanding of your change pathway. The logic model helps to illustrate your pathway of change from the problem you've identified to the activities and outputs to outcomes and finally your impact or long-term outcome. Your logic model is your overarching theory or hypothesis about how your innovation will achieve impact and address the global health problem you are tackling. So first, as we see here, what is the problem? Before you begin, you need to correctly diagnose the problem from the perspective of the customer, the client, or the end user. Second, you need to identify the desired end state. What success looks like when you've addressed the problem. This is the impact you hope to achieve. So you have your problem and you have your desired impact identified. The logic model is what we build in the middle, the steps from problem to impact, or the links in the logic chain. You can build left to right or right to left. But in our experience, the most successful approach is to build from right to left. So that's what we'll do today. First, ask, what are the big things that need to change in order for your impact to be achieved? It can be helpful to think about these as barriers or constraints to the impact being achieved. These big things are generally behaviors, for example, use, or they could also be a whole range of other things, attitudes, norms, motivations, knowledge, understanding, skills, awareness, confidence, access, availability, so many things to choose from. And these can be either about providers or clients. Often there are so many big outcomes. We want to think about these as two different steps or links in the logic chain. So for example, maybe in the shorter or immediate term, we need to change provider attitudes and beliefs around menstruation or FGM. A positive change in the short or medium term might be needed in order for there to be a medium or intermediate term outcome in relation to behavior. For example, high schools providing menstrual health products and our wash facilities and or menstrual health and hygiene education. Those would be more medium-term outcomes. So the next question is, in order to achieve or contribute to these outcomes, your intervention needs to deliver some outputs. Outputs should always be within your control. That is why attitudes are not an output. Knowledge is not even an output. Outputs are direct products or services, such as provision of information or training, or marketing a product or other service. These products and services result directly from the activities that you carry out. These are things that you budget for, such as business operations, research and development, market testing, message testing. The things that you budget for are called your inputs. So now you know what you will do, your activities, and what you will deliver as a result, your outputs, but you don't know, and nor are you in control of what change will occur out there in the world as a result of your outputs. A logic model becomes theoretical or hypothetical when you move from outputs to outcomes and outcomes to impact, because you don't know 100% if it's going to work. You're making assumptions. Assumptions are the beliefs that you have that your theory will hold. They identify where your assumptions are big ones and whether you need to collect more evidence. They also help you identify risks that the logic will not hold and where you may need to tweak or augment your solutions to mitigate these risks. The short-term outcomes should be within your direct influence, but you're making assumptions that, for example, a training will increase knowledge or a marketing campaign will motivate or influence attitudes. The medium-term outcomes are within your indirect influence. So, for example, you're making assumptions that if you achieve short-term outcomes of increased knowledge and motivation, you'll contribute to or indirectly influence behavior as a medium-term outcome. Beyond outputs, therefore, you're making assumptions based on the best evidence that you have to hand. Hopefully, this best evidence will become even better as you implement your solution, because you'll be collecting evidence through M&E that validates or invalidates the hypotheses and assumptions within your logic model. So let's just talk about a couple of common pitfalls as you're building your logic model. First of all, it could be that the TOC or logic model doesn't clearly articulate the change pathways that will be activated once implementation begins. If you cannot conceptualize the change, you cannot measure the change. How do you conceptualize the solution? How do you conceptualize the impact pathways? What needs to change and what do you need to deliver in order for that change to be activated? Secondly, a pitfall is often around incorrect or incomplete identification of the problem. Sometimes the problem is more complex than originally thought, and if you don't fully understand the challenges that consumers or users might have, you may not correctly identify the ways in which your product or service can influence or affect positive change. For example, providing information or increasing knowledge of women may not be enough to change their behavior because the services may not be available or male partners may not allow access. So if you understand the whole problem, you might be able to tweak your solution to have greater impact. Thirdly, sometimes innovators neglect to take account of the complex and interlinked changes that need to happen between outputs and impact. Outcomes in the logic chain are critical, and you need to think these through carefully because they are hypothetical or theoretical, as we've mentioned. You can't just build or deliver something and assume that impact will magically happen. We sometimes call this the "if you build it, they will come" fallacy, and it's a common pitfall. And then finally, impact indicators selected are sometimes not clearly defined, and this is a really common pitfall. It's not enough to say lives saved. We need to be more specific. What's the health outcome or result that will demonstrate that your innovation is successful? So now we're going to play a game called Is it an output or is it an outcome? So if we go to the next slide, you'll see here that there are 6 results statements. And we're going to give you a couple of minutes to read these results statements and sort them into outputs or outcomes. So we'll leave you for a second and let you read these and think about them. Okay, I hope that was enough time. Don't worry if you didn't get all the way through because we're going to go through these on the next slide. So here we have it, the outputs on the left-hand side and the outcomes on the right. So for output statements, we have community health workers are trained to disseminate key messages. And we have training is provided to frontline workers in primary healthcare centers. Now, outputs 2 and 6 are about providing training. This is what you deliver. So this is within your control. This is why it's an output. And then the third output is menstrual health products produced and supplied. You can produce and supply. This is within your control again. So this is why it's an output. The 3 statements on the right are outcomes. Let's talk about these. Improve provision of gender-sensitive and rights-based antenatal care to pregnant women by health professionals. So you can train health professionals, you can provide them with resources and tools to improve provision. So you can directly influence improved provision, but you cannot control this. The 4th one, improve knowledge of HIV prevention, testing, and treatment services amongst girls and women. So you can provide training or information, but you cannot directly control people's improved knowledge. You can influence it directly, but not control it. And finally, increased access to improved water and sanitation facilities. So increased availability is within your control if that is what your product or service is about, but increased access is not within your control because there's a whole bunch of things that might prevent people from accessing things even when they're available. Hope that's been helpful. Okay, so what to measure? You've got your logic model. You've clearly identified the change pathway between problem, which is the current state, and impact, which is the end state, including the targets you're aiming to reach. How do you know you're on track to achieve impact? And how do you know when you've achieved impact or arrived at the end state? There are four key ingredients of impact that need to be measured. First, scale. You need to tell an impact story that shows scale or scalability. You need to capture data on how many lives you've improved or how many lives you've saved. Lives saved is demonstrated by, for example, a percentage reduction in mortality or number of deaths that have been prevented. But numbers are not enough. You also need to measure depth. How much and in what ways are lives improving? What are the actual benefits you're delivering? And how meaningful are these benefits? Equity. Whose lives have you saved or improved? How are you benefiting underserved groups? Change is more profound or more meaningful if you're achieving it for those who've been excluded, marginalized, and discriminated against. This is central to GCC's mission. For example, getting women to attend the requisite number of ANC visits is more meaningful for those that have previously attended none than for those who previously attended half or more. GCC considers equity through the counterfactual by discounting individuals that would have been able to access comparable quality health services in the innovation's absence. Finally, time. Do people experience regular benefit? For example, do they interact with the service regularly? Do they experience prolonged or sustained benefit? For example, have women just attended one ANC visit, which is a small improvement to life, or have they attended 3 or more ANC visits, which contributes to a greater improvement in life? Okay, let's talk about outcome and impact indicators. The evidence threshold for lives saved is high and will require an RCT, a randomized control trial, or pre-post study as per the standard operating procedure guidelines developed by GCC. There are limited innovators reporting on lives saved, so here we're focusing on lives improved. For innovators in the SRHR portfolio, lives improved can be demonstrated by showing an increase in knowledge and/or health-seeking behavior as a result of your innovation. That is the use of SRHR services such as sexual and reproductive health services, and a range of those. For innovators implementing innovations that seek to increase awareness and knowledge on a particular SRHR topic, demonstrating that lives have been improved can include clients showing an increase in knowledge or awareness about, for example, menstrual health and hygiene. Another way to show that your innovation is improving lives is by demonstrating that your desired clients are using your services. Uptake. For example, the number and percentage of total girls and women using contraceptive services for 1 year. Another way to demonstrate lives improved can include showing that girls and women have access to safe and quality abortion services. In this case, the outcome indicator is the number and percentage of total girls and women that receive safe abortion services. For TTS2 innovators, the evidence threshold is an increase in SRHR knowledge and/or awareness. For TTS3 innovators, GCC wants to see a change in the health status of people, for example, a reduction in disease burden. Monitoring and evaluation can help improve performance and achieve results. More precisely, the overall purpose of monitoring and evaluation is the measurement and assessment of performance of an innovation. Monitoring is a continuous process of collecting and analyzing information about an innovation and comparing actual against planned results to judge how well the innovation is being implemented. Monitoring helps to ensure activities and outputs are proceeding as planned and are on schedule. Is everything on track? Are we progressing and delivering as planned? The existence of a reliable monitoring system is essential for evaluation. It helps you keep a routine eye on whether your theories or hypotheses are holding true and what you expect to see is actually happening. And if not, why not? It's a management tool that answers the question, what are we doing? Monitoring is incredibly useful in helping innovators to identify and address problems. Do not wait until a year from now to find out that your logic model doesn't work. If you can identify problems early on, you can make necessary changes. In this way, monitoring can ensure effective use of resources. If you're spending money on something that isn't working, you want to know. It can also ensure quality and learning to improve products and services. This is really important, especially when you're prototyping or piloting. Okay, now on to evaluation. In many cases, innovators will need to conduct an evaluation in order to measure impact. Evaluation involves the periodic assessment of change in lives, behavior, or conditions, and is a process that systematically and objectively assesses all the elements of an innovation, from design through implementation to results achieved, in order to determine its overall worth or significance. The objective is to provide credible information to identify ways to achieve more of the desired results. We know from experience that M&E at its best can contribute to learning and the improvement of work to bring about social change. Finally, fast-moving innovators are often strapped for resources and time and often face challenges in measuring impact. Traditional measurement approaches sometimes do not make sense because they can be too costly and time-intensive to use. Some innovators are using what is known as lean data to collect valuable information on their innovations without doing massive impact surveys. Lean data is meant to be simple, rapid, and cost-effective, and involves thinking about embedding simple data collection methods in your implementation. For example, a receptionist at a primary healthcare center may ask a patient 3 quick questions about their visit with a healthcare provider. Often simple and cost-effective data collection methods can be extremely helpful in helping innovators understand how their innovation is performing. So how will you measure lives saved and lives improved, your outcomes and your impact? There are a number of different methods that can be used to demonstrate your outcomes and impact. Monitoring and measuring will be necessary to demonstrate how your innovation is achieving outcomes and impact. Monitoring is often undertaken by different actors in different ways throughout implementation. As innovators, you hold the primary responsibility for collecting and analyzing data and assessing your innovation's performance. Most innovators have a system or process in place to collect routine data on output and outcome indicators. Collecting data on your innovation's outputs and outcomes on a regular basis in real time generates information about progress on and towards the achievement of outcomes. For example, some teams will be collecting descriptive data on health outcomes, such as number of ANC visits. And such descriptive data can yield important information on whether your innovation is on track. At certain points, however, you may desire to conduct formal studies or evaluations to better understand precisely how your innovation is improving or saving lives. A before and after study, also called a pre-post study, measures outcomes in a group of participants before introducing a product or intervention, and then again afterwards. As innovators, you can use this data to show how changes in the outcomes are attributed to your product or intervention, your outputs. Longitudinal studies involve following a cohort of clients over time, such as those HIV-positive clients on ART, and measuring how their health status changes over time. In a longitudinal study, you conduct several observations of the same people over a period of time, sometimes lasting many years. Other innovators will be conducting formal evaluations and studies using control or comparison groups. Many donors, funders, and impact investors have a preference for randomized control trials, or RCTs. An RCT is an empirically rigorous way to determine if the thing that you are doing, your intervention or innovation, is having the effect you intended it to. It involves careful planning of what exactly you are testing, with identification of the variables and the conditions, and having multiple testing groups with different variations of these variables or conditions. The goal is to be able to have a group that has used the intervention you're testing the efficiency of, and a similar group that has not used it, called the control group. Then you can collect data that will more clearly demonstrate whether the group with the intervention has noticeably different results than the control group. Comparison offers clarity. To demonstrate change, it can be helpful to have a comparison group when possible. One way to do this is to use the nationally available data as the baseline. Innovators are all expected to report results using their RMAF, which is used to establish targets during the funding agreement negotiations, and then submitted with updated actual results every 6 months. It's important to be clear within the RMAF what's being measured and how this links to the innovation. When filling in the RMAF during negotiations, you'll work with a number of members of the GCC team or the core global team to ensure that the results from your M&E activities can be applied and used in the RMAF. For those conducting studies, the study results, including baseline endline surveys, should be submitted to GCC for verification of results. It's important to note whether impact will be measured through an evaluation. If so, innovations must also submit a study protocol and submit baseline and endline reports in addition to RMAF reporting. Once the RMAF is submitted with targets at the outset of the funding period, GCC asks that you don't change the targets. If you're unable to achieve your targets due to unforeseen circumstances, you need to communicate that to your investment manager or program officer, but don't change the RMAF. It's important for GCC to be able to compare what was expected at the outset with what really happened and was achieved during the funding period. If you want to make changes to how you're measuring or reporting any of the results in the RMAF, discuss it with the GCC team you're working with, and they'll advise you on the best way to move forward. The accompanying progress or final report should include a description of what activities were undertaken and summarize the results that were achieved as a result of these activities. The progress and final reports should provide an explanation of the numbers reported in the RMAF. So who is going to be doing the measuring of impact? For most teams, there are in-house M&E staff that routinely collect data on outputs and outcomes. For other teams, they may have formed academic partnerships to conduct formal studies or evaluations, or maybe you've contracted expert consultants to conduct evaluative research. You need to think carefully about your resource requirements. Do you have the in-house capacity to conduct a study, or will you outsource this? How much time and resources can your innovation realistically devote to M&E? These should be considered in defining how you will measure your impact and how you report on it. Innovators can sometimes attract academic partners if they already have robust and high-quality data sets, which can inform longitudinal studies or RCTs. Let's look at some case study examples of GCC-funded innovations. So first of all, Obongo. Obongo is a good example of scale in terms of volume and numbers. Their television show, Achille and Me, improves early childhood development outcomes in viewers and airs in several countries in sub-Saharan Africa. They've achieved over 3 million lives improved to date. They've verified their viewers using data from Kantar Geopol media monitoring and viewership trends through surveys of viewers conducted by 60 Decibels. Equity. Safisana is an innovator who recently done a really good job of demonstrating equity. They're a waste to resource innovation that's conducted a very thorough household survey of the residents living in catchment areas of their waste treatment plant. They included a series of questions to understand the general socioeconomic and demographics of the area. They also included a number of questions to understand counterfactual waste treatment and management. For example, is there an organized refuse dump site in your neighborhood? How do you desludge your toilet facility? And how often do you do this? Where does water from your community go to, etc.? This verified that they're truly getting at the underserved. Operation Fistula surgically repairs fistula in women living in Madagascar. From a Dali Quali perspective, the absence of their innovation would result in women living in very poor quality of life. So this really demonstrates a depth of change in terms of quality of life. And finally, Clean Team is a container-based sanitation innovation who offers a subscription-based service for toilets. They regularly track customer churn as well as customer satisfaction to ensure that clients are consistently using the toilets over time and enabling sustained access to improved sanitation and health outcomes. And now back over to Emily.
Great, thanks. So on this slide, you'll see two squares. On the left is a list of different types of ways that Core Global Venture Advisors are supporting innovations with their M&E plan development. And the box on the right, you'll see the key things that innovators are responsible for in terms of their M&E planning, budgeting, and delivery. So Core Global basically are here to provide technical guidance for the completion of the M&E plan, which can include things listed in the bullets here on the left. Further M&E support can also be provided to innovations after the completion of the M&E plan. And I'll talk you through the process for that on the next slide. So there are two primary ways that innovations are identified for M&E support through GCC's funding. Firstly, the innovator may not have sufficient evidence to generate targets for ultimate outcome indicators in their RMAF or their impact model. And this usually occurs during the due diligence process. Another way that innovators are identified for needing M&E support is through the investment committee. And they sometimes mandate the further validation of health impact as a condition of funding. Some innovations have also requested M&E support of their own volition, usually because of challenges resulting in drastic pivots in their design. And we did see a lot of this over the last year with COVID and evaluations. So Core Global would then assign an M&E venture advisor to an innovation based on a range of criteria, such as matching skills to the needs with expertise, looking at geography or the language needs, as well as the availability of those in the time period that the support needs to be taking place. So during our kickoff stage, we focus primarily on understanding the innovation's M&E needs. And this takes place through a range of different ways. So GCC shares key documents about the venture with Core Global. Our Core Global venture advisor will then have initial conversations with the GCC deal lead to get a better understanding of the current challenges and the anticipated support. The venture advisor will then have an initial kickoff call with the innovator, and sometimes GCC staff will join in. We will hold follow-up calls as scheduled and as needed between the venture advisor and the innovator, and then ultimately develop a plan for support with a timeline and key deliverables that is then approved by GCC. We would then move on to actually delivering the support. So this is where the venture advisor would work with the innovator to deliver the M&E plan for support. We may bring in other specialists from time to time from the Core Global team for specific technical input where this might be needed. And over the course of the support provision, we would keep GCC updated on progress and consult them at key decision points where needed. Finally, the wrap-up stage. This is the final stage where the submission of the innovator's M&E plan would go to GCC for approval. So this would then be reviewed by a member of the GCC's knowledge management team and approved for next steps. Just a point to note that ultimately throughout this process, Core Global's venture advisors would be available for up to 6 days of support allocated over a 6-month period. Some of the venture advisors' time may be reserved for consultation at a later point during implementation of the M&E plan, and this is often just discussed and agreed with GCC. Great, so we've reached the end of the webinar. We want to say a huge thank you for your time. We hope this webinar has provided you with some helpful information on GCC's approach to measuring impact and also the role that Core Global is playing to support innovators with M&E. We'll be sending around a very short feedback survey to help us gauge how helpful this has been for you and also to identify areas where you may require further information or support. And in the meantime, please do reach out to your deal lead with any further questions on M&E. Thanks very much.
Thank you.